Okay, so today we are going to discuss about patients or the relatives who are unhappy with hospital management. So we have a scenario, we will be following the same approach. They are more or less the same approach as angry patients approach. Okay, so you have to follow that protocol, Buster protocol. And there are certain scenarios where you have to arrange for you have to arrange significant analysis meetings. You have to fill in incident report forms. You have to send the patient or the relative to PAL's office, okay, for their feedback. So we would be sending in only one of the scenario, that is the premature baby. So let's discuss about intravenous drug user self-discharge. So we have this scenario, you are FY2 in acute medical unit, 24 years old female wants to leave the hospital. Other information that you have got about the patient is that she was admitted 5 days ago with infective endocarditis. Currently, she is receiving IV antibiotics, which are supposed to be given for 2 weeks. She is an IV drug abuser, and nurses have advised her to stay at the hospital, but she is reluctant. She wants to leave the hospital. Nurse has asked you to talk to the patient and address her concerns. Okay, so you have to deal. This is basically a patient who has been admitted with infective endocarditis, and she's receiving treatment, but she wants to go, she wants to leave the hospital. So we have to explore her concerns, why she wants to leave the hospital, why she doesn't want to complete the treatment. So you are going to explore her concerns. So you will be starting, the starting would be when you enter the cubicle settings would be that the patient would say, okay, finally, doctor is here, I need to go home. Can I go home, please? And then you will be, if she starts like that, then you have to follow the type 2 approach, where you will be using, okay, I beg your pardon, or sorry, can I confirm a few details before we talk about your concerns, or before we talk about this? So by the way, my name is Dr. Aman, or I'm Dr. Aman, one of the doctors working in this department. May I confirm your name and date of birth, please? So then you will be starting the scenario in this manner. And then after you confirm the details, you have done the grips, that is greeting, repo, after building repo, introduction, and purpose or paraphrasing, and then you start, okay, with a smile. And then you have to paraphrase everything, okay, that as I've been told that you have been admitted to the hospital. So can you tell me that what do you know about your treatment? What have you been told so far about your treatment? What's wrong with you? What's going on with you? Did the doctors tell you about it? So you have to tell her, and you have to ask her, what does the patient know about their condition? So you have to explore, okay. And then you have to ask that, okay, how are you feeling since your admission? And then you have asked those questions, and the patient, it is a sort of dialogue, because these are counseling stations, so it would be a dialogue. The patient would ask you some questions, or they might answer your question. So the patient might say, okay, doctor, I'm not comfortable at the hospital. So you need to explore why she isn't comfortable at the hospital. What is it that makes you uncomfortable at the hospital? Okay, so you need to explore her concerns, that why doesn't she want to stay at the hospital? All right. So she will be telling you that, okay, doctor, I'm not comfortable. The reason being that nurses talk bad about me. So you need to explore, okay, so what happened? What sort of things are they saying? Have they said it directly to your face? Can you tell me? Then you have to apologize. You have to apologize, okay? That, okay, can you tell me more about it? And then you start the scenario like this. And then you explore, go on and explore that, okay, do you understand what will happen if you discontinue your treatment? Are you worried about anything? Or can I ask you a few more questions? Okay, and then you need to ask about other medical illnesses, regular medication she's taking, and about occupation. Okay, and then take alcohol history, slowly and gradually progress towards this drug history, including alcohol. After you take the alcohol history, that following the same approach that, okay, do you drink alcohol? How much do you drink? What type of alcohol? How many units a week? And what happens if you do not drink for a day or two? Okay. And what sort of symptoms do you develop? You have to take alcohol history and slowly progress towards drug history, that is recreational drug history. You ask that, okay, I understand from your notes that you have been using recreational drugs. Could you please tell me what kind of drugs do you use? How long have you been taking it? Do you inject yourself? Okay. Do you know anything about needle exchange program? Okay. You have to tell them about needle exchange program. If she doesn't know, then you have to tell, okay, this is a government run program where we provide sterile needles to those who are injecting themselves. So what you can do is you can take the used needle to the pharmacy, and then they give you the sterile needle in replacement. Okay. So then when you need to ask, okay, could you please tell me when was the last time you used this recreational drug? When was the last dose? What happens if you do not take drugs for 2-3 days? Okay. Have you been placed on any medication to prevent withdrawal symptoms? And then the patient might tell you that, okay, I've been taking methadone, or I've been placed on methadone for withdrawal symptoms. Okay. And then you can ask, okay, where has it been started? Did they start in the hospital? And then you need to ask the patient, okay, the patient still wants to go, whatever. Then you should ask, okay, where you want to go. If you were to be discharged, where would you like to go? Okay. Then you have to tell the patient about their diagnosis and what treatment they need and what is the need of this treatment. Okay. How important is the treatment? That, okay, you have got a condition called infective endocarditis, which is basically inflammation of your heart. And it is a serious condition, and you have been given antibiotics for this purpose, and you need to take those antibiotics through your blood vessels. Okay. And we would recommend you to continue with your treatment. So it is not advisable for you to leave the hospital at the moment. Okay. And then the patient might tell you, okay, doctor, I know my rights. I can leave the hospital if I want to. Then you can reply politely that, yes, you do have all the rights to refuse the treatment, but we ask you to get the treatment completed in the hospital. Okay. For that, we would like you to stay in the hospital. Is there anything we can do for you? And then the patient might tell you that, okay, doctor, you are even not allowing me to smoke. So what you can do is you can tell the patient that, okay, if you were to allow smoking, will you stay in the hospital? If we arrange that for you, would it be possible for you to stay in the hospital? And then during when you are talking in between the scenario, there might be the patient might be shivering or may become agitated. Then you can take this verbal and this non-verbal cue, and you can ask the patient, you can tell the patient, okay, I can see that you are a bit uncomfortable, you seem agitated, so I think that might be one of the withdrawal symptoms. So we can review the dose of the medication for you, that is methadone. Okay. And I will also speak to one of my seniors and see how that can be arranged for you. And then you need to inform the patient that, okay, if we are to arrange for you to smoke, is it possible for you to go downstairs and smoke? And if you were allowed to do so, and if you leave the hospital without informing, then what we need to do is we need to involve the security, and we need to inform the police as well, because we need you to come back to the hospital, and you have to write a document, because you have to write a document that you want to leave the hospital. You need to complete the treatment, but you are leaving the hospital against the medical advice. So this would be, you need to make the patient a bit frightened so that the patient may not run away, because she is an IV drug abuser, and she might leave the hospital. She might be finding some way out of the hospital. So that's why she's asking about smoking. Okay. And then at the end, you have to address her concern that she said in the beginning that, okay, the nurses are talking bad about me. So the nurses are talking bad about me. So you have to address this concern. Okay, I'll go and ask them what's the matter, and I'll ask them to come and apologize to you or discuss it with you. Okay. What do you think about our discussion so far? Okay. That's all. You have to counsel. It's basically a counseling station. You have to convince the patient that it is important for you to remain in the hospital and get the treatment completed. There are two or three main things. Okay. First, you need the patient to be in the hospital. You have to tell them that if you want to leave the hospital, then what you have to do is you have to sign a document and do not run away like that. Okay. Without informing us. And then comes another scenario. There's a premature baby. You are to a neonatal unit where a 30 years old mother is here to visit her baby. She delivered 5 days ago. Baby was born at 27 weeks of gestation and is in incubator. Talk to her and address her concerns. There are some questions from mother's side. Why is no one changing her nappy? Earlier there was one nurse. Why can't she look after my baby? I'm worried about infection. Can I take my child to private hospital? So these are mother's concern. So she might be angry, she might be upset, disappointed because she has come to you. She's here to talk to you, and basically the scenario is that she delivered the baby and she came to see her baby, and baby was in incubator and she was covered in poo. So mother got angry and she got upset and she felt extremely disappointed, and she wanted to take her baby to private hospital, and she has come to talk to you, have been asked to talk to the mother and address her concerns. Okay, this is the main theme of the scenario. And then you have to approach the patient, starting with the grips, that is greeting, rapport building, introduction, and then purpose or paraphrasing, and then start with a smile. Okay. And be empathetic because the patient is already disappointed, and this is the patient is angry as well. So what you need to do is you have to acknowledge her disappointment and her concerns, that okay, it is reasonable for you to be upset, to be disappointed. I'm really sorry that this has happened to your baby. Okay. Can I ask you more questions? Could you please tell me what exactly happened? When did it happen? Has this happened before? What exactly is that made you upset? Okay. So then you ask about the child. Before you start, when you start the introduction, there would be ice on the cake. There would be like, you need to uh, ask that, okay, hello, nice to meet you. I understand that you delivered 5 days ago. So how are you doing now? And this is your IPS. Okay. So how are you doing now? How are you coping up with your new baby? And how's your baby? And you need to ask all those questions from them. Okay. So this is the part of IPS. Here is where your IPS comes in. And some normally people start going asking, okay, I've been asked to come and talk to you about this. What's the matter? And this, no, you can do this way. Okay. And then you need to ask, okay, can you tell me that how often do they change the nappy? Were you allowed to change the nappy? When in how many weeks of pregnancy did you deliver? Okay. And the mom would be telling you that, okay, I delivered at 27 weeks of gestation, and then take a short history about pregnancy as well. Okay, were there any complications during the pregnancy? Did your child need any immediate medical attention? Because the child is already in incubator, and you need to ask, okay, any medical attention, any complications after pregnancy? How are you feeling now? So you have to ask all those things. And then you have to ask that, okay, are you worried about anything? I'm really sorry for you. I'm really sorry to hear about this. Okay, we always try to provide best care to our patients or in our department. And now I'm going to see the baby. When you ask that, are you worried about anything in particular? So she would say that I'm worried about infections. So you can acknowledge, you can address her concern that, okay, I understand that's a valid concern. But there is a risk of contamination or infection with contamination in poo or urine. So what we need to do is I'll go and check it myself, and we can run some blood tests to see if she has developed any sort of infection. Okay. So then what you need to do is, because it's a significant event, so what you need to do is you have to fill an incident report form. you have, so that everybody should know about the incident, you can refer the patient to the PALS office, that is Patient Advisory Liaison Services, and you can ask the patient to leave their feedback over there. A patient's attendant, sorry, you can ask the patient's mother to go and leave her feedback over there. Okay, and she would say, okay, what will you do to prevent it from happening it again, and whose fault is this? She might ask you those questions. You should know that how to answer all these questions. That we will be arranging significant event analysis meeting or root cause meeting, and we will be making some changes or modifications in our guidelines and protocols, and all those things you can use here, okay, in this scenario, because it's a significant event. And then she's asking that, okay, why can't you put the same nurse to look after my baby? So you need to tell that, okay, practically putting the same nurse all the time is not possible, because nurses work in shifts, and sometimes we have temporary staff to replace or reposition nurses who are on leave or who are sick. Okay, but we make sure whoever comes will provide the best care. Okay, no? And then the mother might ask you, will my baby have infection? I've already answered that question, that the contamination with poo can cause infection, but we are going to run some blood tests. And mom says that, can I take him or her to the private hospital? And then you have to tell that, okay, it is not needed, or we don't think so that it is needed for your child to be taken to the private hospital, because we will make sure that the child gets proper care in the hospital. Okay, so this is all about this scenario. And after that, we have got another scenario. This is MRSA. So basically, this is a scenario where a patient has been shifted to MRSA ward, and the wife comes, and she is upset because she's unhappy. She's thinking that the doctors have shifted my patient to a specialized ward. Why are they doing so? Why did they do it? So she doesn't get the idea what is the purpose, because she has not been informed, and her husband has been shifted to MRSA ward. So you are FR2 in the medical unit. 55 years old patient was admitted with acute exacerbation of COPD. Swab was taken from his nose, which has now come back to be MRSA positive. Patient has been isolated. Please speak to his wife and address her concerns. Special note, permission has been taken from the patient to take to his wife. Okay, so the scenario would state whether the consent has been taken or not. We will be discussing those scenarios shortly, where we will be discussing the importance of consent, that whether you should speak to somebody, some relative, wife, husband, daughter, son, without the patient's consent. Whereas there are certain instances where you can speak or where you cannot speak, and how much can you speak, okay, and what can you tell them, and what you need to ask them. So other information is, wife will tell you, I do not understand what is happening. My husband has been shifted to a separate room, and you are treating him as if he has leprosy. Why is everyone wearing aprons, gloves, and masks when you go to see him? Okay, so these are the wife's concern. She thinks that her husband is being treated like he has developed leprosy. So why are you treating him like this? Where did he get this infection from? Did he get it from doctors or nurse? Can you treat it, doctor? Can I visit him? Can I take him home? I heard MRSA kills everyone. Will this kill him as well? Okay, so we are going to look into her concerns shortly. And how do you start it? Because maybe you are going to use type 2 approach here as well. You need to start by doing grips, confirm the relationship, and paraphrase that I understand that your husband came to the hospital because he was unwell. And what have you been told so far about your husband's condition? And I can see that you are a bit angry. Why don't you tell us, or why don't you tell me what's wrong or what happened? Okay, so then wife will tell you that, okay, my husband has been in a separate room. Why are you treating him like this? So then you need to use the Eve protocol over here. Remember, whenever somebody is firing emotions at you, You need to fire back, or you need to reply with Eve protocol. Okay, emotions, and validate their emotions, and then respond to their emotion. Okay, and then I can see, you need to say that words like, I can see that you're not happy with this situation. Anyone in your position would be feeling the same. I'm really sorry we did not explain it to you earlier. Okay, let us go through everything together. All right, is that okay? Okay, what have you been told so far about your husband's condition? What do you understand about MRSA? Okay, or MRSA? Does he have any other medical conditions? You can explore about any other medical conditions as well, because he has got COPD. And apart from COPD, has he got any other medical conditions? And you need to explore that. Wife has mentioned about leprosy, so you need to ask, okay, you mentioned about leprosy, do you have any experience with leprosy? And then she might tell you, okay, I have read it on Facebook or Google, or there was one patient, and my uncle, or whatever story she might tell you. Okay, so then you need to explain that, okay, let me explain to you. When we admit anyone in the hospital, as a routine procedure, we screen for MRSA bugs by taking swabs from the nose. And your husband is found to be carrying this bug in his nose. So the wife might ask you that, okay, doctor, tell me, where did he get this bug? She asked in the question. And then you need to tell that, well, at the moment, he doesn't have infection, because she has not got that she has not got this, that her husband has MRSA colonization. Basically, it is colonization. It's not infection. So you have to explain that, okay, at the moment, he does not have any infection. He is just having this bug in his nose, okay, on the lining of his nose, which means he has only MRSA colonization. And every one of three people have this bug in their nose. It is not something to be worried about, but MRSA can be transmitted from one person to another person. But in your husband's case, this is the answer to her question, that where did he get? But in your husband's case, as when he was admitted to the hospital, we took this swab at admission. So it seems that he might be having this colonization or this bug before admission to the hospital. It means that he has not got it from hospital. Okay. And then wife will say that, okay, what are you going to do for him now? And you have to say that we have started the treatment. He has been given antiseptic creams, which he needs to apply to his nose on both sides. You can tell the duration as well, around 5 days, 2 to 3 times a day. And he also has been prescribed antibacterial shampoo. And he has also been advised, or we would be changing the towels and beddings every day. Okay. And why be asking that, why have you shifted him to a separate ward? So you have to tell that, unfortunately, it can spread to others. That's why your husband has been shifted to another ward. That is the ward where we manage people with MRSA bug. And we have nurses and staff over there who know how to treat and restrict this bug from transmission to other patients. Okay. And the next concern is, she is saying that why is everyone wearing gloves and masks when you visit him? Okay. You have to tell that this is to prevent the spread of infection from one person to another person. Wife says that, okay, can I visit him? So you can say that, yes, you should be able to visit him, but you have to wear personal protective equipment, that is gloves and mask, and you have to wash your hands before and after visiting him. Okay. And the next question is that, what will you do if he has got infection? He has got this infection. She's talking about infection. Okay. So if he gets infection, your reply should be that, if he gets infection, we will be giving him antibiotics. And if you know the name of the medicine, you can say we will be giving him antibiotic called vancomycin. It is better to remember, but if you do not remember, no need to say. You can just say that we can give him some antibiotic that are specific for this bug. Okay. And then the wife says that, okay, can I take him home? So you have to say that MRSA on the skin, that is colonization, can also be treated at home. But in your husband's case, we have already started treating him. After 5 days, we will be taking the swab, and we will be making sure that he doesn't have those bugs or MRSA bug. Okay, and at the moment, he doesn't have an infection, but he has low immunity because of the exacerbation of COPD. So so if he becomes infected, situation may become worse. Okay, so as you live with him, there may be a chance you carry those bugs. I would advise you to get tested as well. Okay, and you need to take appointment and ask her to go to her GP, take appointment for this swab, taking swab for MRSA testing. Okay, this is all about this scenario. You have to address her concerns in detail, because these are not like history taking scenarios. These are counseling scenarios. So it is a sort of dialogue. There will be questions coming and you need to answer those questions. So we need to address all those concerns. And then Clostridium difficile, it is very much similar to the above scenario. I won't be going into the details. I will just be discussing the questions or the concerns. Okay, the starting and everything would be same. Let's go through the scenario. You're referred to in general medicine, 80 years old, has developed diarrhea. Other information, he was admitted 10 days ago with chest infection and has been receiving antibiotics. 2 days ago, he developed diarrhea. Stool sample tested positive for Clostridium difficile. He has been shifted to a different ward where there are other patients with similar symptoms, receiving IV fluids and antibiotics. Talk to his son and address his concerns. Permission has been taken from the father to talk to his son. Okay, so you have to talk to his son. It's the same scenario. In the above scenario, you need to talk to wife, and here you have to talk to son. So the son might have some questions or some concerns. So let's go through. You have to start with grips, then paraphrase, and then ask about some questions. What have you been told so far about your dad's condition? Why was he admitted to the hospital? What treatment he was given? How long has he been given antibiotics? Okay, he has been taking antibiotics. How long has he been taking these antibiotics? Has anyone explained the side effects to you? Okay, and has anybody okay, and has anybody explained the reason for diarrhea your father is having? Okay, does he have any other medical illness or any medical condition? Is he taking any regular medications? Did anyone tell you that the stool sample was taken? You have to ask all those questions. Okay, because it has been written in the scenario that this has been done. So you need to ask those questions. Be particular and specific about asking those questions. And then you need to tell that, okay, explain it to the son that, okay, as we discussed, your dad was admitted with chest infection and he was given antibiotics to treat this. Unfortunately, your dad developed diarrhea 2 days ago. And when someone develops diarrhea, we send a stool sample to the lab to check that what's causing the diarrhea. Okay, what is the cause of the diarrhea? When we got the result, unfortunately, it showed that he developed diarrhea due to a bug called Clostridium difficile. Okay, and Clostridium, then you have to explain, okay, Clostridium difficile is a bacteria that usually lives in the gut, but they are usually in controlled numbers because we have another type of bacteria called normal gut flora, which keep check on their growth. Okay, but when somebody has been prescribed, particularly elderly, when they've been prescribed antibiotics for longer period of time, so they can they destroy the normal gut flora, and as a result, the number of C. difficile can increase. Okay, so they get a chance to cause this infection. Okay, so which can cause diarrhea. Right now, your dad is being treated with fluids and antibiotics. The scenario has already been, it has been given, receiving IV fluids and antibiotics. Okay, and we are giving him different antibiotic called metronidazole, which is the antibiotic of treatment for C. difficile, and he has also been given fluids to prevent any kind of dehydration. Okay, and the son asked some question that, okay, doctor, can it be food poisoning? So you need to ask that it is not food poisoning. The food served in the hospital is prepared in a hygienic way. And moreover, we also have the stool sample test, which shows C. difficile, unfortunately, which is a side effect of antibiotic treatment for a longer period of time. Okay. Son, can I visit him? The same answer. Yes, it shouldn't be a problem. You can visit him, but you need to wear PPE, including the gloves and mask, and you need to wash your hands before and after visiting your father. Okay. Another concern comes that does this happen frequently in the hospital? So you need to tell that this is something that doesn't happen frequently, but can happen in elderly if taken antibiotic for a longer period of time. There is a separate department that keeps record of it. And if you like to know about it, I can refer you there. All right. So that's the questions, that's the answer to this question. And then, so another, again, same question, that why has he been shifted to a separate ward? Same answer, that it is because everyone has this type of, anybody who has this type of infection, we need to shift them to, we need to isolate them, shift them to a separate or a specialized ward where we have skilled staff, and we have equipment to deal with this kind of infection in order to prevent it spread to other patients. Okay, this is the answer. And then let's go to another scenario. Next scenario is CP ankle sprain. Okay, so this is basically a scenario where a father has come who has taken his who brought his CP child. It's a child with cerebral palsy, brought to 2 weeks ago, who had some ankle sprain. So he's unhappy because he thinks that the doctor at that time was in a hurry and did not check his son properly. So let's see this scenario. You are FY2 in emergency department. 25 years old boy fell down and sustained ankle injury and was brought to the emergency department 1 week ago. Okay, it's 1 week ago. He sustained ankle injury after falling from the wheelchair. He had ankle bruises, but no bone tenderness. Okay, no bone tenderness is there. He was assessed and discharged home without X-ray. Father has brought him back to the hospital, talk to him and address his concern. So the father he has come and he is unhappy because he's thinking that doctor was in a hurry and doctor did not pay attention because he is a CP child and doctor did not treat him well. So you have been asked, you are here to address his concern and you need to talk to him. Okay, so what you need to do is you need to approach would be the same, do the grapes, you know that how to do the grapes, and then paraphrase and then ask about the previous way. What you need to do here is you need to take you need to let me tell you the approach. What you need to do is you need to ask about previous history. You need to take history of the presenting problem. Why has he come now? And then you examine the patient yourself and then explain that how you manage the ankle injuries or this particular type of injury, which is ankle sprain. Okay, what is the management for this? This is the approach for this scenario. So you will be asking ask 4 questions. Those 4 questions that, okay, what was the reason you brought your child to the hospital 1 week ago? I understand you brought him. What was the reason? What investigations were done? What treatment did they? What were you told about it? And what treatment did he get? And how is he doing now? Okay. Did they do any particular investigation, including the X-rays and all those things? You can ask about them as well. And then you have to take this history, a bit of history, that is medication history, that is PMA, Holy Family. You can just quickly go through it. Okay, because he's a CP child and he might be having some other problems as well. So you can just quickly take medication history, allergy history, and past medical illnesses, and these you can just go for short history. Okay, and then you need to ask about current situation, that how is the child now? Is he still having symptoms? Is he in more pain? Has the pain subsided? Or is his ankle swollen? And is he able to walk? Is there anything you're worried about in particular? You need to address those concerns. And then you tell, okay, I would like to examine him. And you must know the name of the patient. Okay, for example, his name is James or Matthew. Also remember the name of the patient. It is it looks good when you remember, and it gives a good impression that, okay, you are paying attention, you are fully attentive, you know the name of the patient. So you have to ask, okay, let me examine Matthew, let me examine Charles, or let me examine James. Okay, and then after you have examined, you will be written examination findings will be given to you. Okay, the examination findings normal. The examiner might reply you, okay, everything is normal. There is no bone tenderness. Okay. Explain that I have examined, and from what you have told me, it seems that he has got ankle sprain, which means overstretched ligaments around his ankle joint, and basically it is a soft tissue injury. Okay. You do not have to worry because it will take some time to heal, so you should continue with the treatment, or you should continue with the same regime which you were advised on the last visit. Okay. And the treatment or the management would be price regime. That is price regime is that is uh, prescribe painkillers, rest. It's P for prescribe painkillers or painkillers, and rest, R for rest. Ice, I is for ice. Okay. You need to apply ice for 15 to 30 minutes. Do not apply directly, and wrap it in a towel and then apply it. Okay. And if the pain gets worse, do not apply it, and do not apply for less than 15 minutes or more than 30 minutes. Okay. And then C is for compressions and E is for elevation. Okay. This is the management. You need to tell the management again. And father might have some questions that, okay, why didn't you do the x-ray last time? So you have to explain that if there is, he was examined last time and there was no bone tenderness. So if there is no bone tenderness, there's no need for doing an x-ray, because it would do more harm than doing good, because it would expose him to unnecessary radiations. Okay. So, and then the father might say that he was not initially, he might say that my child was not assessed properly, the doctor was in a rush. And then you need to explore that, okay, what makes you feel or what makes you think that your child was the doctor was in a rush. Okay. That your child was assessed in a rush. So is there something on doctor's part which he did that made you, or that gave you an impression that he did not check your child well? Okay. And I'm sorry, then you have to apologize. You need to apologize that, okay, I'm sorry I'm sorry that about it, you felt like that. But this is a normal approach for anyone of us to check and examine and follow this protocol for any person who presents to us with ankle sprain or ankle injury. Okay. As a doctor, we do not treat people differently. For us, every patient or everyone is the same. Okay. You have to tell it. And then you can offer leaflets about it, ankle sprain, leaflets about ankle sprain. And then you need to arrange follow-up in 1 week's time. Okay. This is all about CP ankle sprain. Are you getting me so far? Okay, let's move on to another scenario, because these are important scenarios. Sometimes you do get these scenarios. So okay, that's good, perfect. So let's move on to next scenario. The next scenario is post-MI physiotherapy. You are FI2 in medical unit. 65 years old lady was diagnosed with MI and has CABG done 4 days ago. She is upset and has refused to talk to the physiotherapist. Talk to the patient and address her concerns. Okay. Basically, the patient had heart attack 4 days ago, and she is now recovering. And the last 4 days after surgery went very well. And then throughout the time, the nurses have been very nice towards her, and the nurses have been telling the patient to take some rest. But she has been referred to the physiotherapist, and the physiotherapist, who is Miss Sarah, who has asked the patient to start exercising and walk around. Okay, to start mild or to moderate exercise, with which this patient is not happy. So the patient is a bit upset, and she has refused to talk to the physiotherapist. So you are here to talk to the patient that, okay, what's the reason why you did not go for physiotherapy? Why hasn't she talked to the physiotherapist? Okay, you need to explore her concerns. All right. So how are you going to start the station? You will be you need to talk to this lady, do the grips, and paraphrase that I understand you came into hospital with this heart problem, or you had an MI. I'm really sorry to hear about that. This is your IPS. Okay. I'm really sorry to hear about that. So ask the 4 questions. How are you doing now? And could you please tell me what was the reason? What sort of symptoms did you have? You already know that she had MI, but you can ask that what symptoms did you have? What investigation did they do? What diagnosis, or what did they tell you about your this type of condition? And what did they do for you? What treatment did you get? And how are you doing now? Okay. These are the 4 questions you need to ask. And then you can ask the patient that, okay, I've been informed that you have refused to talk to the physiotherapist and you don't want to continue with her. Okay, so can you tell me what happened? You need to explore. And then the patient might tell you, okay, doctor, patients say that the nurses are telling me to take it easy. They've been very nice to me, but physiotherapist was very mean. She told me to exercise. Okay, because the patient is these are the patient wording. Patient is saying that the physiotherapist was being mean. Because she asked me to exercise. How can I exercise? I recently had a surgery. So you need to apply Eve protocol over here. Okay, whenever somebody is firing with emotions, you fire back with Eve protocol. Okay, I understand. You should say that, okay, I understand that you might be afraid to walk around, but I'm really sorry because what the physiotherapist, that is Miss Sarah, is trying to do isn't very well explained to you, or we didn't explain it to you earlier. Okay, so the reason for the physiotherapy should have been explained to you earlier. I'll explain to you everything and then go into the details that, let me tell you that the nurses are right, or the nurse is right. It is always advisable that immediately after the heart attack, uh, one should take rest for a few days. Okay. And in the meantime, the physiotherapist is also right. Mrs. Sarah, who is a physiotherapist, physiotherapist who is a mobility specialist. They are specialized in their field, and they know when and how someone should mobilize or move around after a heart attack. Okay. It is important to mobilize after the heart attack, because it is not possible for you to be in bed for a longer period of time, or to be in bed all the time, uh, because there is risk of development of clots, and you can tell the patient the development of clots in the legs. Okay, so we need to prevent that. That's why we want you to mobilize as early as possible. Okay, so we need to give slow pace exercise under some guidance. That's why you have been referred to Miss Sarah. Okay, so then you have to tell that, okay, what we suggest, our advice is that you should start mobilizing at a slow pace under some guidance with the physiotherapy. Can I just ask you to you that whether you understand now? Okay, are you getting me so far, or have you understood what I am trying to say? Okay, you can ask. And patient says, okay, yes, doctor, I understand now. Okay, and uh, then you need to ask for you need to tell the patient that, okay, when you move around or you do exercise, so do you get any chest pain, any shortness of breath, or any heart racings? So the patient, or any leg swelling, have you noticed any leg swelling? The patient might say, no, doctor, I haven't. So then you can say, that's fine. So it's completely fine for you to go for physiotherapy. You should continue with Miss Sarah. And what we can do now is we can run some tests like ECG, that is heart tracing, and also a chest X-ray. Okay. If there is anything after we have done the test, and if we find that if there is anything that is preventing you from physiotherapy, we will let you know. Okay. And then you ask that, okay, how does that sound? What do you think about what we have discussed so far? And the patient may be at the end, the patient may be happy, or she might get the idea that why you want to mobilize her as early as possible. Okay, and then you have to say, sorry, I'm really sorry, this should have been explained to you earlier. And I'll also speak to Miss Sarah. Okay, this is all about this post-MI physiotherapy. And last scenario is post-hernia raphe wound infection. It is pretty much the same scenario we have discussed that day. That was post-op infection after removal of a cyst. Okay, it is very much same. You need to go with the same approach. You need to address the concern, paraphrase, do the grapes after you paraphrase, ask this question, and then take history of infection. Okay, ask about discharge present or not, what color is present, is it foul smelling, and any oozing, any fever, any pain, any swelling. Ask about all those things, okay, that are related to this particular condition. Okay, so then you need to take some history about past medical conditions that might be preventing this wound from healing. That is particularly about diabetes, this taking drugs like steroids. So you need to ask this short history about medications, allergies, this medical illnesses. And hygienic, you need to take history about social, like drinking, smoking, wound hygiene, rest, lack of rest. Okay, you need to ask, because basically the patient here is a factory worker and he started going to factory earlier than the time he was advised to. So you need to take some history that I mentioned about HOPI, that is PMA, Holy Family, Desatoli. You have to ask that history, okay? And occupation is important because he might have started lifting heavy weights again, or might be his job is such that involves a high risk of infection, okay? Contamination leading to infection. So then you need to examine the wound and do abdominal examination, and then tell the patient about the diagnosis. That unfortunately you have wound infection. It is one of the common complications of operation, going back to work. In your case, I understand, or in your case, the reason being for wound infection is going back to work, and also you smoke, going back to work early, and also you mentioned that you have been smoking. That could be a possible risk factor that has contributed to wound infection, okay, or delayed healing. And then what you need to do is you have to manage it. You need to admit the patient, take cultures, send the swab for cultures. Okay, take swabs and send it for culture, start him on IV antibiotics, and inform the seniors about this condition. Okay, that's all about this infection. So you can read this scenario. Fire to an emergency department, 45 years old, male presented with a wound problem. He had herniorrhaphy 3 weeks ago. Assess the patient and discuss further management. Patient had a hernia repair 3 weeks ago. 5 days ago, noticed smelling and oozing of the wound. Wound is open, greenish discharge, otherwise fit and well. Work in the warehouse and lift heavy things. Went to work immediately after surgery, but was advised to rest for 4 weeks. Okay. So did I get infection from the hospital? So you need to tell that, okay, no, you didn't get this infection from hospital. It might be because you went to the work earlier before the time we advise you to go. Okay. That's all for yesterday's scenario. Unhappy patients, those are angry patients. And we have covered this spikes protocol for breaking bad news, this cones protocol for medical errors, buster protocol for angry patients, and patients who are unhappy with hospital management. Okay, we have covered all those scenarios. So let's move on to ethical scenarios. Let's begin with ethical scenarios.